Hi, my name is Dr. Sarita Patil. I'm a practicing allergist at Allergy Associates at Massachusetts General Hospital and an assistant professor at Harvard Medical School. Today we're going to talk about how to evaluate food allergies. Food is a complex substance made of many different kinds of molecules which have an equally complex system for digestion, processing, and distribution. As a result, there are many different types of reactions that we can have to foods. Some reactions are driven by the immune system, and we call those food allergies. Some uncomfortable reactions are driven by other types of processes, and those are called food intolerances. Within the umbrella of food allergy, there are many different kinds of food allergies or many different kinds of reactions that can be driven by the immune system. One of the most common types of reactions that we see in the allergy clinic are food allergies that are driven by allergy antibodies, also called IgE. These food allergies driven by allergy antibodies can occur in very young children to adults. In this type of food allergy, an individual that has this kind of food allergy has allergy antibodies or IgE antibodies that can bind to a food protein. These allergy antibodies float around in the system and sit on top of allergy cells. When these allergy antibodies encounter a food protein that they can bind to, they activate the allergy cell. When that allergy cell is activated, it results in a systemic reaction that can cause many different types of symptoms, including itching, hives or welt-like lesions, swelling, nausea, belly pain, throwing up, diarrhea, and even passing out. These reactions can occur immediately on encountering the food. If the reaction does occur, we can treat it with an injectable medication called epinephrine. Because allergy antibodies are so sensitive and they can respond to even small amounts of food, it's very important for us to identify foods that might be causing this reaction in people that are affected by food allergies. To do this, we have two different tests. The first test looks for allergy antibodies that might be floating around in the blood. It's a blood test looking for these specific antibodies. Recently, innovations in this test have made it even more precise as a tool for figuring out which foods might be causing a reaction. The second kind of test looks for reactions of allergy cells sitting in the skin. This test is called skin prick testing. To test the allergy cells in the skin, we take an extract from a food, put a small drop of it on the skin, and wait for 15 minutes for a red, raised, itchy welt to form at the site. Then we measure it, and this helps inform us about the foods that might be driving the reaction in a certain person. In people who have had these reactions, these tests can be important ways for us to figure out which food or foods might be driving someone's reaction. Food allergies that are driven by allergy antibodies or IgE are important to evaluate in the allergy clinic using those two tests that we have just described. On the other hand, food intolerances are driven by other processes, and allergy testing with IgE tests are not useful for their evaluation. If you think you might have a food allergy that we can help you with in the allergy clinic, please contact our office and we would be happy to help.